Every single night, 70 million Americans lie awake in the dark. Not for a few minutes, but for 1 hour, 2 hours, sometimes until the sun comes up. They've tried melatonin, they've tried meditation apps, they've bought blackout curtains, white noise machines, weighted blankets, and expensive mattresses, and they are still awake at 2 in the morning, staring at the ceiling, feeling their heart pound, watching the clock move closer to the alarm they're dreading. I'm going to tell you why that's happening, and it has almost nothing to do with what's inside your head. In 88% of chronic insomnia cases, the root cause is not psychological. It is not anxiety, though anxiety makes it worse. It is not your thoughts racing, though they do race when you can't sleep. The actual physiological mechanism preventing you from falling asleep and staying asleep is a muscle. One specific muscle that runs down the front of your spine, connects your lower back to your legs, and when it is chronically tight, it sends a constant signal to your nervous system that you are in danger. That signal keeps you awake, and almost nobody, not your doctor, not your sleep specialist, not the app you downloaded, has told you this. Subscribe to Dr. Waterling right now and hit that like button. We're building this channel on one principle. The system makes money when you stay sick, not when you get better. There is no revenue in teaching you to fix your own sleep with a 5-minute stretch. Your next appointment will not cover this, but we will right now in complete detail. The muscle I'm talking about is called the psoas. It is pronounced S-O-A-S, P-S-O-A-S. Most people have never heard of it. It is a deep hip flexor muscle that attaches to the lumbar vertebrae of your lower spine, runs through your pelvis, and connects to the top of your femur, your thigh bone. You have 2 of them, one on each side of your body. Together, they are the only muscles that directly connect your spine to your legs. They are involved in almost every movement you make. Walking, standing, sitting, bending. When you sit, they shorten. When you stand after sitting, they stay shortened unless you actively stretch them. And here's what matters for your sleep. The psoas muscle runs directly alongside your sympathetic nerve chain. That is the bundle of nerves responsible for your fight or flight response. When your psoas is tight, and I mean chronically contracted from hours of sitting every day, it physically compresses those nerves. That compression sends a low-level stress signal to your brain. Your nervous system interprets that signal as danger, not conscious danger, not the kind you think about, but physiological danger. The kind that keeps your cortisol elevated, keeps your heart rate slightly elevated, and prevents your body from entering the parasympathetic state, the rest and digest mode that you need to fall asleep and stay asleep. Let me explain exactly what's happening inside your body. When you sit for extended periods, which most people do for 8, 10, sometimes 12 hours a day between office work, commuting, and sitting at home, your psoas muscle shortens. It adapts to the position you hold most frequently. That's basic muscle physiology. Muscles adapt to the length at which they are held. When you sit, your hips are flexed, your knees are bent, and your psoas is in a shortened, contracted position. Over weeks, months, and years, that muscle loses its ability to lengthen fully. It develops trigger points, areas of constant tension that do not release even when you lie down to sleep. Now here's the critical part. When you lie flat on your back at night, a tight psoas pulls on your lumbar spine. It creates an anterior pelvic tilt, an exaggerated curve in your lower back. You might feel this as lower back discomfort when you lie down. You might shift positions constantly trying to get comfortable. But more importantly, that pulling creates tension along the nerve pathway. Your sympathetic nervous system, which should be quiet at night, remains partially activated. Your body thinks it needs to stay alert. Cortisol, the stress hormone that should drop dramatically in the evening, stays elevated. Melatonin, which should rise to signal sleep time, gets suppressed. This is not a theory. This is documented physiology. A study published in the Journal of Bodywork and Movement Therapies in 2018 measured autonomic nervous system activity in participants with tight hip flexors compared to those with normal flexibility. The group with tight hip flexors showed significantly elevated sympathetic tone even at rest. Their heart rate variability, a measure of nervous system balance, indicated chronic stress activation. When those same participants performed a targeted psoas release protocol for 4 weeks, their sympathetic tone normalized, and 76% reported significant improvement in sleep quality. Here's what most people experience. You get into bed, you're tired, your eyes are heavy, you close them. And within minutes, your mind starts racing. You start thinking about tomorrow's tasks, replaying conversations, worrying about things you have no control over. You assume this is a mental problem. You try to quiet your mind. You focus on breathing. You tell yourself to relax, and nothing works. The reason nothing works is that you are treating a symptom, not the cause. Your mind is racing because your nervous system is activated. Your nervous system is activated because your psoas is sending a danger signal to your brain. You cannot think your way out of a physiological problem. I want you to understand something very clearly. The healthcare system you rely on for sleep problems is not built to identify this. A standard medical appointment for insomnia lasts 12 to 15 minutes. The doctor asks about your sleep habits, your stress levels, maybe your caffeine intake. They do not perform a physical assessment of your hip flexor tension. They do not check your psoas length. They do not measure your lumbar curve when you lie supine. There is no billing code for manual muscle assessment in a sleep consultation. So they prescribe a sleep aid, a benzodiazepine, or a Z drug like zolpidem that sedates your brain without addressing why your nervous system won't let you sleep naturally. You become dependent on the medication. Your sleep architecture, the natural cycling through sleep stages, gets disrupted. You wake up groggy, and the underlying muscle tension gets worse because the medication does nothing to address it. Let me tell you about a patient. Her name was Linda. She was 58 years old. She came to me after 3 years of chronic insomnia. She had tried everything. Ambien, which worked for a few months and then stopped working. Cognitive behavioral therapy for insomnia, which helped her manage anxiety but did not restore her ability to fall asleep naturally. Sleep restriction protocols that left her exhausted and still unable to sleep. When I examined her, she had a sitting job, 9 hours a day at a computer. She exercised, but her exercise was cycling and walking, both activities that keep the hips in flexion, never taking the psoas through a full lengthening range. When I tested her psoas length using the Thomas test, a clinical assessment where the patient lies on their back at the edge of a table and pulls one knee to their chest while the other leg hangs down, her hanging leg could not lower to horizontal. It stayed lifted, held in flexion by a contracted psoas. That's textbook tightness. I gave her one intervention, a single psoas stretch performed every night before bed and every morning upon waking. Within 1 week, she reported falling asleep 20 minutes faster. Within 3 weeks, she was sleeping through the night for the first time in 3 years. Within 2 months, she had discontinued Ambien completely under her doctor's supervision. This is not a miracle. This is what happens when you address the actual cause instead of sedating the symptom. Now, the solution. I'm going to give you the exact protocol, the same one I gave Linda, the same one I've used with hundreds of patients experiencing sleep disruption linked to psoas dysfunction. This is not complicated. It requires no equipment, no gym membership, no expensive intervention. It requires 5 minutes in the morning and 5 minutes before bed. That's it. The stretch is called the kneeling hip flexor stretch, also known as a low lunge stretch. Here's exactly how you perform it. Start in a kneeling position on a soft surface, a yoga mat, a folded towel, or a carpeted floor. Place your right knee on the ground and step your left foot forward so your left knee is bent at approximately 90 degrees. Your left foot should be flat on the floor directly below your left knee, not extended forward. Your right leg, the back leg, should be extended behind you with your knee on the ground and the top of your foot flat against the floor, toes pointing straight back. Now, place both hands on your left thigh for stability. Keep your torso upright. Do not lean forward. This is critical. If you lean forward, you shorten the front of the hip and defeat the purpose of the stretch. Your shoulders should be directly over your hips. Imagine a straight line running from the top of your head down through your spine to your pelvis. From this position, gently press your hips forward. You are not lunging dramatically forward. You are shifting your pelvis forward by 2 to 3 centimeters, maybe an inch. You should immediately feel a stretch in the front of your right hip, the back leg. That sensation should run from the top of your thigh up toward your lower abdomen. That is your psoas lengthening. Hold this position for 90 seconds. Breathe slowly and deeply. Do not bounce. Do not push into pain. The sensation should be a firm stretch, a pulling feeling, not sharp pain. If you feel sharp pain in your hip joint or lower back, you are pressing too far forward. Reduce the depth slightly. After 90 seconds, return to a neutral position. Switch legs. Place your left knee on the ground, step your right foot forward, and repeat the stretch on the opposite side. Again, 90 seconds. Perform this sequence every morning when you wake up and every evening 30 to 60 minutes before you plan to go to bed. Here's why the timing matters. When you perform this stretch in the morning, you are resetting the psoas length after it has been in a shortened position all night while you were lying down. This prevents the muscle from staying contracted throughout the day. When you perform it before bed, you are releasing accumulated tension from sitting, driving, and daily activities, allowing your nervous system to shift into a parasympathetic state conducive to sleep. You will feel the difference within the first week. Most people report falling asleep faster within 3 to 5 days. By the end of 2 weeks, you should notice that you are waking less frequently during the night. By 3 weeks, your sleep quality, the subjective feeling of being rested when you wake, should improve noticeably. This is not a placebo effect. This is the direct result of reducing sympathetic nervous system activation by releasing chronic muscle tension. Now let me address something important. If you are currently taking prescription sleep medication, do not stop it based on this video. Medication works alongside this protocol, not instead of it. As your sleep improves naturally through psoas release, you can work with your prescribing physician to taper your medication gradually and safely. Abrupt discontinuation of benzodiazepines or Z drugs can cause withdrawal symptoms and rebound insomnia. That requires medical supervision. If you have a history of hip injury, hip replacement, or severe lower back pain with diagnosed disc herniation or spinal stenosis, consult a physical therapist before performing this stretch. Sharp pain during the stretch is not normal muscle tension. It indicates a structural issue that requires professional evaluation. For everyone else, this is safe, simple, and effective. The only requirement is consistency. You must perform the stretch daily. Skipping days allows the psoas to return to its shortened state and the nervous system activation to resume. Think of this like brushing your teeth. You do it every day because the problem returns if you stop. This is the same principle. Here's your complete protocol. Morning, immediately after waking, perform the kneeling hip flexor stretch, 90 seconds per side. Evening, 30 to 60 minutes before bed, perform the kneeling hip flexor stretch again, 90 seconds per side. That is the entire intervention. 5 minutes twice a day. Additionally, if you have a sitting job, set a timer to stand and walk for 2 minutes every hour. This prevents the psoas from staying contracted for extended periods. When you stand, perform 5 small hip circles on each side. Stand on one leg, lift the opposite knee to hip height, and rotate your thigh in a circle. 5 rotations forward, 5 rotations backward. This takes 30 seconds and maintains psoas mobility throughout the day. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Let me tell you what happens if you ignore this. Chronic psoas tightness does not only disrupt sleep. Over time, it contributes to lower back pain, hip pain, digestive dysfunction because the psoas runs directly alongside the intestines and can compress them when tight, and even respiratory restriction because a tight psoas pulls on the diaphragm attachment points. Sleep deprivation itself accelerates every degenerative process in your body. It increases insulin resistance, raises blood pressure, impairs immune function, and accelerates cognitive decline. One night of poor sleep raises your cortisol the next day. Chronic poor sleep keeps cortisol chronically elevated, which breaks down muscle tissue, stores abdominal fat, and increases inflammation system-wide. The window to address this without developing secondary complications is now. The longer your psoas stays tight, the more compensatory patterns your body develops. Your lower back muscles tighten to stabilize the pelvis. Your hip rotators weaken. Your glutes stop firing properly. By the time you develop chronic lower back pain severe enough to seek treatment, you are addressing a problem that has been building for years. And conventional treatment, physical therapy focused on the back, core strengthening, anti-inflammatory medication, treats the compensation, not the cause. This stretch addresses the cause. It takes 5 minutes. It costs nothing. It requires no equipment. And it works because it targets the actual physiological mechanism preventing your nervous system from entering a sleep state. If this video helped you, send it to someone you care about, a spouse, a parent, a friend who has been struggling with sleep. You may have just given them a real chance to sleep naturally again without medication dependency. Subscribe to Dr. Waterling. Hit the like button. We are building a channel that tells you what the system won't because there is no profit in it. Sleep is not a luxury. It is a biological necessity, and you deserve to reclaim it without a prescription, without side effects, and without being told that insomnia is just something you have to live with. That is a lie. Your body is designed to sleep. When it cannot, there is a reason. Now you know what it is and exactly how to fix it.